Hi, I'm Eliot Sykes. I'm a consultant anaesthetist and intensivist and an associate medical director.
And I'm Charlotte Routh, and I'm an acute physician, and I'm one of the Trust's clinical strategy leads.
So, Charlotte, for people who've ever wondered if there's a clinical strategy behind Northumbria, I think we're here today to explain what it is, why we're doing it now, what it involves, who it involves, and who ultimately will benefit from it, and most importantly, how people can get in touch with us if they want to get involved or contribute. So let's start with, what is the clinical strategy for Northumbria?
Yeah, well, some people might be aware that the sort of first bit of our clinical strategy was to build a new emergency care hospital. That was 8.5 years ago and was a long time in its progression to that point. So we opened up a brand new hospital, and that was sort of a really different thing for the Trust to be doing at that time. It was the first emergency care hospital in the country. So we're moving on from that now. We've done that, and we're progressing forward with really thinking differently about how we might want to reimagine patients' care. We know that people feel differently about their care post-COVID. We know that the geography of our patch is quite tricky. It's a big patch. And we really want to start thinking differently about how we can deliver patients' care, making it more person-centred, thinking about maybe giving it closer to home, and also making it sort of more timely and easily accessible to patients.
Yeah. So you've touched on some of the key aspects that we're starting to talk about in terms of the strategy. What would you say is key in terms of, you've talked about the Northumbria Hospital, about how we're looking to change healthcare going forward? Yeah,
so I think the Northumbria Hospital was all about delivering emergency care, but actually we don't want people to get to the point of being in an emergency situation. We know, and there's lots of evidence now and lots of stuff coming out nationally about the more we do and the more proactive we are about people's health in general will mean that they live healthier for longer. People are living longer, they're living with more conditions, and actually what we need to do is help them stay as healthy as they can for longer, and keep their chronic conditions under control for longer. And make sure that when they do have conditions and are needing healthcare, that we provide a method of them not ending up in emergency situations, that we catch them before that. But also we look at the sort of wider aspects of health, and we know that public health is really important. By that I mean we know that smoking, obesity, high blood pressure, the state people live in is really important and has a big effect on how they live and how healthy they are.
Yeah, so keeping people healthier for longer and out of hospital in their homes. Okay, and who does it involve? Who do we need to involve if we're going to get this right?
Yeah, well, I think ultimately the first people we need to involve is the patients, or the people that we look after and care for within our organisation. And our strategy is really about changing the focus to what do they need rather than what do we provide for them. So we want our care to be really person-centred, where we're thinking about what the people need, and that might be that they need to access things in a timely fashion. It might be that they know how to access things. We've made our health system very, very complex, and it's really hard to know where to go, and some people just really struggle with knowing where the right place to go to. We want to make sure that we account for things like some people can't use IT, some people want to see people face-to-face, some people want to use the telephone. We know that people work, some people don't work, people have childcare responsibilities. So we want to make healthcare accessible for them so that they can actually get good care, and it works for them as well as for us.
So patients and people are clearly at the centre of this. Are there any other parts of the healthcare system that we need to involve as well?
Well, absolutely. I think for us within Trust, our staff are really important because they're going to be delivering that care. And there's loads of great energy and innovation already that goes on within Northumbria. And our staff are keen to change as well. They're sort of been working at pace. They've come out of COVID tired, and people have got lots of good ideas and really want to deliver the best care for their patients. So our staff are really important to us because ultimately their ideas and what they want to do and their knowledge of their patient groups is really important in developing services that meet their needs. But also we work a lot with people outside of our Trust. We work with primary care, and the majority of our patients get the most bits of their care within the community, not within the hospital. So it's really important for us to start working with primary care partners, and we've already started some really great meetings and collaborative working with them. But also the voluntary sector is really important to us. They support a lot of the people that we look after, and they've got a host of things that they can provide which we can't provide within trust. So being able for us to work with them so our patients can access other things outside of the hospital environment is really important.
Yeah. So I think collaboration and co-design with patients and staff is absolutely key, is what you're saying.
Yeah.
And ultimately, if this is a success, who will benefit?
Yeah. Well, we'd hope that the patients would benefit. We wouldn't be doing it otherwise. So we want patients to feel that they are listened to, that they've been involved in this strategy, that they have been able to access and change healthcare for what works for them. So working hard with our patient experience team to collect information in a different way than we traditionally collect it, so to be more about what matters to the patient and less about what matters to us. Our comms team have been going out into the community and meeting patients and carers and also voluntary sector to listen to them and hear what they've got to say. And some of our feedback will come from those people. It's hard when we're changing the model from traditional to know how the outcomes will be in some respects and how it's easy to measure numbers, but actually it's harder to measure what matters to people.
Yeah. And you've mentioned outcomes. Ultimately, that's about what does success feel like for the new strategy. Any initial thoughts on that?
Yeah, and there's things that our patients will feed back to us, but there's also, we know there's loads of repetition within our healthcare. There's loads of people that end up in the emergency aspects of our trust who haven't been able to access care from the teams that know them. So we'd hope that there'll be some efficiencies that come out of it. We'll hope that people won't get to that crisis point if we're more proactive about managing their care and they know how to access the people who normally look after them.
And I think you've also alluded and talked about some of the more simpler things in life, so living healthier for longer, exercising on a regular basis. They're also some of the things we'd probably start to say are a success. Yeah,
absolutely. And some people may have already heard about making every contribution count. It's been already rolled out within the trust, but we should see ourselves as healthcare professionals as when we see our patients, we shouldn't just be talking about their conditions. We should be offering them support for other aspects of their lives. We've already got a great smoking cessation scheme within the trust. We should be happy to talk to them about their weight, exercise. We should be asking them about their homes and the states they live in and their finances. So really we need to work out by talking to our patients what things affect their health that aren't just clinical, they're about their whole life.
And if you had a sort of key message for people listening, what would you say are the key 2 or 3 words that sum up the strategy, having spoken to a lot of patients, the public and clinical teams already?
So we know that patients want personalised care, and we know that that's really important to them. So they want to be thought of in the world that they live in and what really matters to them. They want their care to be timely. We live in a world where people can get things at the click of a button and things happen really quickly. But actually, we know that timely access to healthcare prevents people ending up in crisis down the system in the emergency healthcare scenarios. Also, we want to be compassionate. I think Northumbria has got compassion at the heart of what it does, but that really matters to patients, and it probably really matters to our staff as well, delivering compassionate care.
Yeah. And then finally, how do people get involved? Because I think you and I would agree it's absolutely essential that we hear from clinical teams, from patients, because those messages, those comments and that co-design is absolutely at the centre of the clinical strategy and how we develop it.
So we're interested in hearing from everyone, really. We want to hear from patients, we want to hear from carers, we want to hear from families, and we want to hear from our staff members. So we've got an email address, which is haveyoursay@Northumbria, so please feel free to contact us on that. And we've got a website, and that link will be on the end of this podcast for people to contact us. Say what you want, tell us about it, we'll listen, but also if you see us in passing, catch us and speak to us in person.
Thanks, Charlotte. And I'd like to thank you for listening. And I'd really like to ask you to continue to keep updated with the website as we develop the clinical strategy. Thank you.